things going on with yourself? What were your chief complaints?
So the
like,
biggest
can you point
complaints,
to them for me?
besides I guess the Disney part, for a while there, and I get it every now and then, it was like right somewhere around the scapula or underneath it. I don't know what it was, like a pulled rib or not. But like I couldn't breathe.
Which side? Left side, right side?
Left side. I'm feeling it right now, like right on this area, and I think
on the left, the right hand side,
right
SI joint.
Like right, yeah. So
Do you mind if I feel
no,
it?
right, yeah.
Okay, so this is your SI joint right here.
Mm-hmm.
Is that where it hurts?
It's not really hurting. It's just like
sore.
Yeah, it's like really sore, but I can't really do anything. Like I can't.
Is
really...
it more out to here?
No.
So it's central. Yeah. More like here.
Yeah.
Okay. Look back. Yeah, and then if I go like that, see how we should be able to flex you here.
Yeah.
You've got range of motion because you take care of yourself.
Yeah.
But there's your body's guarding itself right there. It's just really locked about four knuckles like this.
That's what it feels like a lot of time. Like I feel like.
So I can move it, but I can't just leave it there. Yeah. I gotta like clean it out.
No, yeah.
Okay, and then that's gonna be a little sore for a few days. Okay. Same thing with this. Yeah. Gotta clean this out as well. Mm-hmm. You're not a real difficult case. I am gonna check your neck. That's probably the most, like where I have to pay the most attention to.
I really think the years of just
that's locked.
Football.
Could be. But see this, look at that. Easy.
Yeah,
easy. And now we go on the left hand side, locked.
Yeah.
I can't move it. Well, without without a big adjustment. There you go. Any dizziness as I'm doing this?
Nope.
Okay, I'm just checking in. I gotta really go and move this segment.
Yeah.
All right, other side. Sometimes when the muscles relax, other things come to the surface.
Gotcha. Oh, yeah, I felt it.
Yeah, you feel that.
Mm-hmm.
I'm like, ooh. I just put my hand on you and went, oh!
Yeah, it's like, feels good, and it's like, oh, pinpoint.
Oh. That is a tough one to break loose. I'm having trouble. Let's see what happens when I adjust it, okay? Any dizziness that whole time?
No, just some crunching. That's about it.
Oh, no. I meant like room spinning or...
Yeah, no.
No. Oh, look at that thing. I think you already moved it, though.
Oh, yeah.
Sometimes I gotta lie. Now, if I could do the same trick on the other side.
No, that's what I was waiting for. Like, all right, where is it at? Like, where are they gonna trick me?
The other side. Yeah, you can only do that one trick once. You gotta do something else. You gotta have like a whole bunch of tricks up your sleeve. And here we go. Yep. Oh. It's so stuck too. Right here. Think thoughts here. Good. Oh, I don't know. Right here. And lower, a little bit lower section. Is that okay?
Yeah.
Oh, there it goes. Perfect. Breathe. Okay. All right. The neck was a little rough, but yeah. It's okay. Just let that drain for a second, okay? Here we go. I'm going to see where you place your weight, okay? Yeah. See how this is tighter?
Yeah.
Ugh. Yeah, so the looser side is where usually the weight is placed because it kind of spreads those phalanges out.
Yeah.
And it kind of makes
them
more pliable.
Years ago when I went, they took x-rays. My pelvis was...
Your pelvis is
like
twisted this way. Yeah, it's okay. Join the club. Welcome to planet Earth.
I'm not perfect. Like
No. I often wonder if Jesus had subluxations.
He is neck cracked.
There you go. Did Jesus need a chiropractor? Watch out for those lightning bolts, Brenda. Okay, there you go. There. Perfect. I'm not doing the arms over the head. Just dragging you down the table. Whenever anybody grabs, it just tightens the whole posterior chain.
I felt the lower back. Didn't hurt or anything, just
Yeah.
Stretched it.
So I just have to drag him. All right. So are you ready for the adjustment?
Oh, yeah.
Deep breath in. Oh, yeah. Good. And I'll let you breathe on this one. This is the bad one here. We're going to put these back in. Excellent. Okay. Whew. Okay. Yeah, I know. It's rough.
No, that was good though.
Yeah, when you feel it in your chest, it means it worked. Okay. Deep breath in. Oh, yeah. Perfect. They're all going back in, one at a time. I'm trying to get way up here. Sorry, my legs there, but I'm trying to push like way. All right, that's as much as I'm gonna go. And again, right here. Okay. You really have flexible skin. All right, doing okay?
Oh, yeah.
All right, here we go. Second side. This side isn't as bad, so I don't have to work as hard.
Feels a lot smoother.
I mean, there's one right here. Remember I told you there was one on the opposite side? But it's not as bad.
Now, would that be because of all the throwing I've done? It's always in that area.
I mean, I don't know. You have a lot of buildup here on the left. Are you right-handed, left-handed?
I'm right-handed, but I'm a switch hitter, so I was always going right and left.
Yeah, but this is markedly larger on the left. I'm just going to work through all of these, okay? You let me know. I'm kind of aggressive, so you just tell me to back off or whatever. So take a deep breath in. My elbow's going to go right into here, okay? And I'm going to hold pressure. Yep. Wiggle, 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 wiggle. Come on. Your ribs are like, ah. No, I don't want to. And that one, there you go. I'm going to take it from this side. Okay, I'm going to count backwards. Oh, it feels much better. 5, 4, 3, 2, and 1. Hey, no, it's pretty good. Cold.
Oh yeah.
Cold gel. I'm gonna try.
Really
I'm gonna try a cold gel. See if that helps at all. Usually I use like an oil, so we're gonna try a cooling gel. Okay. See if I can't cut down on some of the redness. Is that okay? That's the scraping.
Yeah.
You let me know if anything's overly sharp. Okay.
Okay.
Ribs are ticklish.
Always.
Okay, 1, 2, get down into the lat. There we go, good. Oh, that is cooling. It's coming right through my gloves. Is that too cold?
No, it feels good.
Okay, I'm just like, I can feel whatever they put in there, the menthol or...
So what's the difference between scraping or getting, like cupping?
So cupping is pulling the adhesions, like when I did the skin pulling on you. Mm-hmm. Scraping is smoothing out that roughness. Now you can use the cupping to glide, which is how I use it when I do cupping.
So scraping is just a little better.
A little bit more coverage, okay?
Yeah.
Whereas the cupping is pulling.
Yeah.
This is pushing.
Gotcha.
I'm trying to increase circulation here. They're both good. Cupping's more gentle. Sometimes I feel like the skin is glued to the ribs, and I will use cupping.
Gotcha.
But you don't. Your skin, remember how earlier I said, no, your skin is stretchy. I just don't think cupping, it would be as beneficial as this. Now, when somebody's skin is stuck, and I can't glide it around, we do cupping first. And you'll see some videos where I do cupping. It's not a common occurrence for me to find it that way.
Gotcha.
It does happen though. But because your skin is so stretchy, I'm just going to use that to my advantage.
That's at least one good thing I got going.
Yeah, you're probably inherently flexible. Now what I noticed is that you're losing the curve in your low back. Okay, so you're either tucking your pelvis as a personal trainer, maybe you tuck your pelvis a lot. But you're kind of hurting your low back there in my world, okay? You're rounding this lumbar spine and you're all swollen here on the left. And it's interesting because you're sore over here.
Yeah.
But this is all swollen here.
I mean, I guess I get that. Like when I do like certain exercises, I can't get my low back to
curve.
To curve, yeah. You know,
it's almost like you need to stick your belly out like a catcher stance.
Yeah, like I got a huge butt wink, but it's like
I don't care about the butt wink.
Yeah.
I need you to stick your butt out.
Yeah.
You know, and yeah, the butt wink happens because you can't keep that curve in your low back, correct?
Pretty much.
When you're doing a squat, it wants to tuck.
Yeah.
Yeah, so you have to work on not just putting a curve down here, but getting this part more flexible.
Gotcha.
People think that, I got to curve this. Like, no, this part naturally curves, and when you start to lose it, that means the force is being distributed in the reverse direction, usually up here in the kyphotic area, where the kyphosis naturally occurs, which is the thoracic spine. So we got to decrease the kyphosis in the thoracic spine. Low back will naturally curve, and you'll lose that butt wink. People just don't. It's a lot of work to get the upper back to move.
Yeah.
So people are like, no, I'm just going to use my lower back because that's so much easier.
Because people just keep telling me just to work on my hamstrings. But I'm like,
of course.
I work on it a lot, but it's not.
How about your spine, you know?
Yeah, exactly. Because the rest is up to them when they get home.
That's what I'm saying. You know, I can do all of this work on you. Yep. And then you go to the gym. And you pull it right back out again. You know,
yeah.
So that's why I teach you guys as much as I can in here about proper extension. People always forget about extension. They always want to do forward flexion because that gives the most immediate relief. Extension is long term. It takes a long time to get relief from extension. Both arms above your head. You're just going to touch elbow to elbow.
Oh, okay, I see.
No, I'm just going to do both of these infraspinatus. It won't, this
Gotcha.
And everybody focuses on the hamstrings, and I'm like, how about up here?
Yep.
It's the rib cage. Yeah, rigid structure. Hamstrings are pliable. They're just blobs of tissue. How about ribs? Very rigid. The more flexibility you give here, the less you're likely to sprain them, okay?
Gotcha.
But because they're so rigid, one goes. This one's going to keep going forever and always because it's the one that's loose.
Okay.
And then it's going to swell up. You'll see it in a second. There's a lot of crap that's in there. Your body's trying to stabilize it, but it can't because of the curvature of your spine. You have a lateral curvature here on the left. And the apex of your curve is right here. So no matter what you do, you're going to be fighting just sheer physics.
Okay.
You have a curve. You understand the lateral curvature here.
Yeah.
This is the apex, and that's bam. That's where it keeps spraining.
Okay.
So, the only thing we can do is increase the flexibility of the spine so that you're distributing the force along the rib cage as evenly as you can, and not just boop. This one keeps going, you know. Yeah. Okay, run, relax. I usually just go up the back of the leg, okay?
Okay.
Up into the ischial tuberosity right here.
Okay.
I'm just warning you.
Yeah, the calves are always jumpy.
They're sore. That's why I'm using my hand, okay? The roller would kill you.
Yeah, our old trainer used to use a roller. Used to scream.
No, hamstrings feel good.
I did just do legs today, so I don't know if that counts.
They're loose. You know what I mean? They're nice and there's no knots. There's no tension. Right as we get to the knee, on the medial side, you have some. But it's not bad. Not by a long shot. Not what I see and hear every day. You got some, tension in your calves. That's about it. And probably it ends right at the knee.
I was told that maybe because my feet are flat.
They're not that flat.
But that's what I was told a while ago.
Okay, this is a bad one. I'm gonna hold you guys down. Take a deep breath in. And here we go. All right. All right, you ready to stretch? Here we go. Look back, go up. That's it. Is that okay?
Yeah, just a little tight below, like down low.
Right here in your low back?
Yeah.
Okay, relax. We're not there yet.
I felt it there a little bit.
When I push?
Yeah.
Right here?
A little bit to the right of that. Like right there. Oof.
Okay.
Yeah, that one hurt.
I know, I'm moving nerves. That's a damn nerve. It doesn't feel good. These are nerves. Hi. Woo! They're not muscles.
Oh. I just gotta laugh it off.
We all just love that one. That's the one where they pinned Dr. Mondragon down. Pain.
Yep, pain.
It burns us. It burns.
Oh.
Okay, done. Now let's try. I won't take you back as far, okay?
Okay.
Just up here. We don't have to go as far. There it is. Let that go, let that go. That's it. All right, head down.
Oof, chills.
Are you okay?
No, I'm good. I'm just kidding.
Good. All right, one more. Just open up the chest. Let it go. Oh, let that chest go. That's it. I can see the right-hand side is resisting. All right, on your back for me. There you go. I know.
Oof.
That's it.
Wow.
I've almost got the whole shoulder girdle. It's not easy if you're going to be using your pecs, to then.
Yeah, I just did it yesterday too.
Oh, sorry.
No, you're good.
Then it's going to make it hurt more. That was not his ribs.
Okay, I'll be here.
This side isn't as bad. Which is surprising.
Yeah, it
'cause
doesn't
of
hurt
the
as
back.
much. Yeah, it's worse on the left, yeah. I'm just really spreading all over.
It's okay. No, that's it. That's all that one's got. Okay. Oh, yeah, you're back.
Oh boy. Oh, it's not that bad. I thought it would be worse. I was thinking the whole back. Yeah, but I can see that everything's upper mid.
7 days, okay?
Oh yeah, gotcha.
See how I'm pushing in.
Yeah.
I'm not doing that.
Oh, I see it. Hey, yeah.
Do you
I
see?
Mhm.
Okay. Yeah. That's all I take it. Whew. Yep, and on your other side. Right. So when you pull it away, you kind of tear it. I'm pushing it back in. Now you're gonna look back. Cause watch, look back. Yes or no? Yes? You're okay?
Yep.
Now look backwards for me. Backwards, backwards. That closes the space down. Does that hurt?
No, just stretch my abs.
You understand? I'm pushing. Now if I can't get that, I'll lean you over more. This when you tuck, you're popping your discs, you're squashing your discs
Oh, that's
when
what
you
I'm
tuck.
doing.
Yes. Why am I hurting? Because you're squeezing them like a sandwich. Okay? Open them up. Get a curve back. You open the disc space up this way. You're squashing them this way.
Okay. So that'll be similar. I think someone said something similar to that when you're deadlifting and your chest was too high. So you have to get your chest over the bar a little bit and push your butt out, basically is what you're saying.
Yes. All right, elbow back for me. Excellent. More pops, okay?
Mm-hmm.
Excellent. Just getting blood. Just getting stuff moving. Getting lubrication in the joints, okay? And elbow back again. Excellent. Gotta be careful on your... So he's not hypermobile.
Yeah.
But his skin is super stretchy, making me think he's got like a little bit of it. That's it. No deeper level. That's it. And everybody was like.
I know. It's like a yawn. It's just addictive. Yeah.
Lean away. Good. There you go. Good, good. Good, excellent. There you go. Okay, and done. Whew. Time to stretch.
Oh.
I know. Feels like a lot. Every
I feel
whole.
like you're someone to go to sleep.
Get it?
I think it's there.
Okay.
Yeah.
And then you lean back.
Yeah.
Yeah.
So I can
Is
feel
it
it
too
on that
much?
left. Well, it's not too much, but I can feel where it's.
You're not going to sprain it
Yeah.
by going this way.
No.
You'll
Yeah.
sprain it by going forward.
Mhm.
So try to see if you can't get it backwards. Open up. You're not going to sprain it, is my point. You're actually going to squish that fluid out.
So do I just keep going?
No, you just stay there.
Stay there. Okay.
Yep. Now, if you want more of a stretch, you do your arms over your heads.
Yeah. 'Cause sometimes it cracks this way.
Everybody wants to roll.
Mm-hmm.
I'd rather you do
Step level. Okay. Gotcha.
2 minutes, 4
Like a
minutes,
block.
whatever.
Gotcha.
Okay, because everybody wants to roll, and in order to roll, you have to do what? Curve.
Curve.
But take a deep breath in. And just let it go. There it goes. Okay, relax. One more time. I'm going to go a little deeper. There it is. All right. And down. Done. Okay. I don't know. Sometimes it just feels good to be wrung out.
No, yeah.